Hi, I'm Dr. Sharon Alisonati, and on behalf of Healthy Women, I am so thrilled to welcome you today to Facebook's live event and our recorded event, which will be posted on our Facebook page in upcoming days. It is Life Interrupted, Personal Stories and Perspectives on the Impact of aTTP. In honor of TTP Awareness Day, we have gathered an esteemed panel for what I know is going to be an inspiring, thought-provoking, and empowering conversation about acquired thrombotic thrombocytopenic purpura, known as aTTP. And I'm sure that I botched some of that, but our panelists are going to get it right. One of the hardest things about having this rare blood disorder is the uncertainty that comes with knowing when you may experience a life-threatening episode. And this recording is so valuable for both persons that are patients, but also for healthcare professionals. I'm Dr. Sharon. I'm an internist, geriatrician, health educator, and health strategist, and I am going to learn a lot, even though I'm a medical doctor. So please repost this on your pages and let's all learn together. Today, we will be joined by Amanda Schwartz, who was diagnosed with aTTP in 2016 at the age of 30, shortly after the birth of her second child. Since her initial diagnoses, Amanda has battled aTTP episodes and challenges associated with the disease. Professionally, Amanda works in healthcare administration, which gives her a unique perspective from the medical field. She is both a full-time worker and a full-time patient that has very much invaluable information and is willing to share her personal story with us. We know aTTP in any condition really impacts more than just one person. It impacts everyone in the patient circle. Joining Amanda is her husband, Brian Savage, who will share his unique perspective on supporting his wife living with this disease, because yes, families live with the disease with their loved ones, and the impact of this condition and what it has had as far as impact on their family. We will also hear from Vicki Nicolls, co-founder and president of the Re-Win Foundation, which was established in 2012, 1 month after the sudden unexpected loss of her daughter, Rashima, to aTTP. Since then, she has been on a mission to promote awareness of aTTP, to reduce the mortality rate and enhance the quality of life of those living with this disorder. And then finally, we are joined by an expert, Dr. Camila Masias, a medical oncologist at the Miami Cancer Institute, who specializes in the diagnosis and treatment of blood disorders. Dr. Masias will provide thoughtful education on aTTP in a way that we can all understand, including signs and symptoms of the condition, conversation starters for patients and caregivers with their physicians, and advice on how aTTP patients can take an active role in the management of their own health. Our panelists will be answering your questions. If we get them on Facebook Live today, but we also have prepared questions and just real dialogue on this very important disease. Now, this session is about general information, life application, life stories. We are not going to address treatment options. We ask that you speak to your physician or healthcare provider about your concerns, specifically about treatment. We want to thank Sanofi Genzyme for their support in helping us bring this important topic to life. Our hope today is to continue to drive conversation around aTTP and to motivate and inspire others to become active. The key word is active participants in their health, and certainly participants in the aTTP community. So let's get started. Thank you, panelists, for taking your time on today. I am going to ask that you all just introduce yourself as only you can. We're going to start with Amanda, then we'll go to Vicki, and then we'll go to Dr. Masias. Quick introduction for our viewers.
Sure, absolutely. Thank you so much, Sharon. That was a wonderful introduction. My name is Amanda Schwartz, and this is my husband, Brian Savage. As Dr. Sharon mentioned, I was diagnosed at age 30 with aTTP. When I was first diagnosed, I felt very lost in terms of what is this? Where's the information? And so it's just really wonderful now that, 5 years later into my diagnosis, we have the opportunity to do outreach, advocacy, and spread awareness, specifically with International TTP Day, which is tomorrow, September 18th.
Excellent. Vicki?
Hi, thank you, Sharon. Thank you all for inviting me here today. Okay, so the ReWin Foundation, we are a nonprofit advocacy organization. And just as Sharon mentioned, we were established in 2012, but all was done in honor of my daughter, Rashima. Who was diagnosed with TTP, and in less than 24 hours of having a TTP crisis, she lost her life. So just a little bit about my daughter. She was a beautiful, smart, accomplished young woman. She was full of life. And prior to going to the ER, there were no signs and symptoms of her having any medical issues. But the day we went to the ER, she presented with extreme flu-like symptoms, along with chest pains, nausea, diarrhea, and confusion. So, prior to that, she really enjoyed life, like long walks in the park, bike riding. Bowling was one of her passions, and she also mentored young women. So it was kind of very difficult in the ER, just watching my daughter's health decline as she was lying in the hospital bed. It's any mother can feel the heart of watching their child going through any type of medical or any type of devastation in their life. But in the midst of this overwhelming storm, my family and we just felt compelled that we had to do something. So in Rashima's honor, we felt like we needed to help people, patients and loved ones that were impacted by TTP. So we were in search of finding some place to make a donation, and we weren't able to find much information or local organization. So that's what caused us to launch the ReWin Foundation.
Thank you for that. Dr. Masias?
Hi, thank you so much for the invitation. I'm very excited to be here today talk about acquired TTP. I'm a hematologist, as Dr. Allison already mentioned, and I take care of patients with bleeding and clotting problems, but I have a platelet clinic, and I see patients with TTP. I trained at Ohio State University, which has an expert in TTP, and I'm very excited to be able to share more knowledge about this rare disease.
Excellent. And you said it, Dr. Masias. A lot of people don't know about aTTP. You said it is a rare disease. Again, I'm an internist and geriatrician, and of course, I've heard of it. I couldn't treat it to save my life and would have to look at medical school books again, to be quite honest. So how common is it? And if you could just tell us what, in simple terms, what are the signs and symptoms, risk factors, and who gets TTP?
Okay. So TTP stands for thrombotic thrombocytopenic purpura, which is a mouthful. We need to come up with better names for sure. But the acquired one, the one we're gonna talk about on this topic, it's a rare disease. And I think, when I say rare, it's maybe 2 to 5 cases per million patient population. It's extremely rare, and it's characterized. We all have in our body an enzyme called ADAMS TS13, another mouthful, and I'd like you to think of it as Velcro, as a piece of Velcro. The ADAMS TS13 it helps cut another important enzyme called another important coagulation factor called von Willebrand. When we don't have Adams TS13, and I'm sorry, think of Adams TS13 as a scissor for this Velcro piece, which is the von Willebrand factor. When we don't have our scissor for the Velcro piece, the platelets are gonna attach to this Velcro piece like tennis balls, and they're gonna form clots in our small vessels.
Mhm.
That's why it stands for thrombotic, because patients present with clots in the microvessels, and clinically we tend to see that with patients present with abdominal pain. The most serious cases present with strokes, with heart attacks, with kidney problems, and thrombocytopenic, meaning that low platelets happen because these platelets are being consumed in these small clots.
Mhm. Mhm.
And I would say that, you know, when we were all in medical school, we would learn about these TTP pentad and 5, you know, things. And now, fortunately, because of series like the one we're doing right now and presentations, there's much more physician awareness, and we rarely see the pentad that we all thought, which, you know, patients present with altered mental status and fever, you know, dark urine. So the symptoms of, as you've heard, are very different. Every patient is different, but I would say that more commonly we see weakness, abdominal pain, and God forbid, when they present with more serious cases, they present with stroke-like symptoms, so tingling, numbness, unable to move one part of the body and whatnot.
Is there a specific age group, and what about gender?
Yes, so
and race.
it is, I would say that there's not a specific gender. It is some series, because it's a rare disease, we rely on case series, and some series have shown that it may be a little bit more common in women, and typically presents in the age group of around 30 to 50. That the children also can present with TTP, but usually they present with a type that is related to a genetic missing of the enzyme, not the type we're talking about right now. However, our elderly population also can have TTP. And actually, new studies have shown that unfortunately, we're not doing a good job diagnosing these patients because we don't have it in our mind. We think, oh, this 70-year-old lady with diabetes probably has a stroke because she's diabetic, and we don't think about TTP. So we certainly need to do a better job at diagnosing these patients.
Excellent. Now, we've heard from the medical aspect, but Amanda, you actually are living with aTTP. Did you know about this disorder before? And tell us briefly about your receiving the diagnosis and what went through your mind.
Yeah, so no, like probably many people, I'd never once heard of this rare blood disorder. And it was a very, because it's so rare when you present in the ER, to Dr. Masias' point, physicians don't automatically think, well, let me check this. Blood counts, let me check, you're having abdominal pain, you don't feel good, you're tired. It's very flu-like. And when I went to the ER, because an urgent care physician actually identified my low platelet count after I had returned to the urgent care a few times because I could not kick this flu. What I now know is petechiae was all over my body, which I was just like, oh, I don't know what that is. It's fine. I'm sure I'm fine. Right. And so then I was transferred to another local hospital in my community where they thought I had aTTP, which is another bleeding disorder that's a little more common in women of my age. And it was really, I'm a very lucky person. I have a hematologist, oncologist, family friend who was able to talk with our on-site physicians, who then did some peripheral smears and talked about, what was going on with my diagnosis. And they said, hey, you have aTTP. Now, when you're experiencing this, my platelet level was about 7,000. Somebody is talking to me about very clinical, detailed, rare information, and I'm going, I can't process this information. I don't truly understand. And there's no handbook for the hospital to hand it to you because it's so rare. So I can say that it was devastating for me, although I didn't understand the severity of it, truly until I started getting a little bit better and I could really see, hey, this is what happened to me. My doctor at that time had said potentially it was because of the birth of my daughter, but I was already 4 months postpartum. And since then I've had 2 relapses, the recent one just being June of this year, in fact. And so, yeah, it's very tough. But for events like this is so wonderful to spread this advocacy and awareness, because 5 years ago when I was diagnosed, I didn't have these resources. I didn't know where to look. And so the ReWin Foundation, as well as Answering TTP Foundation, has been just such a wonderful resource for me and my husband and my family.
That is a great lead-in for Vicki. Vicki, could you tell me, and again, I so appreciate you telling your story as a mother who lost a child to this disease, even though she was a young woman, but she's, again, a child, your child to this. So the Foundation is a leading resource, and please tell me the age at which your daughter was diagnosed, but a leading resource for the aTTP community. And you've been very engaged. And you talked a little bit about why you started the organization and what do you aim to achieve through your work?
Okay, so my daughter was 38 when she was diagnosed with TTP. She was a mother of 2 young boys. So it was very difficult, for them as well. But our work is really, it says it pretty much in our mission statement that we want to, I'm going to use the word eradicate TTP. We're working towards helping to assist with raising funds for research and treatment. And one of the things that we have done too in the past is we've held blood drives. And through our blood drive efforts, we've actually been instrumental in saving up to 1,500 lives. Now, that's not all individuals that have been impacted with TTP, but we're talking about preemie babies, accident victims, cancer victims. So the whole goal is to improve the quality of life of not only for TTP patients, but for everyone. As far as our support for TTP patients and their loved ones, we utilize our support groups. And Amanda could probably attest to this. When there wasn't much information out there for her, and my daughter was in 2012, there was even less information then. But TTP patients now are blessed to have more information with sources like Answering TTP. The US TMA is another good source, and the ReWin Foundation. So support groups alleviate that feeling of isolation where patients and loved ones can come together and someone actually understands their language. So when you begin to talk about TTP, no one has any clue about what you're talking about. And then another thing, most TTP patients, they look normal. So people were like, okay, you had TTP, you had treatment, you recovered, you're good to go. They are not good to go. They still have the fear of potential relapse happening. Amanda just talked about relapsing. And also mentally and emotionally, it has a great impact on them. So that's our focus, to help TTP patients and loved ones get through.
I'm hearing a lot about Amanda has a patient, did not know about this disorder. You as a mother and had a daughter diagnosed, and then you became an engine for educating and really impacting the community. I will say again, as a physician, Yes, I learned it in medical school. I maybe saw one or two patients. So Dr. Masias, I will call us out as healthcare providers and the healthcare community. What are the challenges that physicians and other healthcare professionals face when diagnosing TTP, and how familiar are we with aTTP?
I would say that, so the challenges are that the differential diagnosis when a patient presents with the symptoms that Amanda mentioned or that Vicki mentions about her daughter are very non-specific. As Amanda put it perfectly, it could just be the flu, right? So a perfectly healthy young woman comes to the emergency room feeling weak, but nothing, and so certainly not only TTP, but any rare disease will probably be very high in the differential, right? The problem with aTTP is that it is a medical emergency. So we are definitely raising awareness with, I would say me as a hematologist, I'm obviously more aware of this entity, but we need to do a better job educating emergency room physicians, intensivists, because they'll be the ones who actually see the patient before us and they're supposed to call us. So that's one thing. The other challenge that we're facing, which is a good challenge, is that the field on TTP is moving fast. We know different things about the disease. We used to say, this is just an acute illness, and once you're recovered, you're cured, you're done. And now we know that's not the case. Patients have a 30 to 40% chance of relapse, meaning that they can have a very similar event at any point in their life. Most commonly in the first year after diagnosis, but it can occur at any point in their life. And so they definitely need a follow-up with a hematologist for that, try to detect relapses earlier. But also we know now that patients with TTP have a variety of long-term complications related to high blood pressure, memory impairment. Patients, tell you, I'm just not the same. I used to work at a bank and I just can't concentrate anymore. And as you've described better than me, it can be very isolating for patients because they go back to the office and they say, I had this disease called TTP and nobody knows what it is, right? Versus if you say I had hepatitis or,
or a stroke, or I had a stroke, or I have the flu, or I have COVID,
So it's very, very difficult on our patients and their families for sure.
I love that you brought up, and I want to bring Brian in, if you can.
Yeah, absolutely.
I want to bring Brian in because really, as Vicki is a mother, Brian is a husband that, again, in geriatrics, we say all the time, you don't diagnose one patient, you diagnose their whole village. We know that TTP in any condition really does impact more than just the patient and everyone in your circle. Based on your personal experiences, what insights can you share with our audience? And our audience is growing on Facebook. Please give us your questions about the unmet needs that exist for loved ones, and how, has a guy that's supporting your woman, how do you support your wife in this?
Yeah, well, it's already been alluded to. One of the big challenges is just the kind of absence of information, especially at the beginning, and trying to understand the full range of impacts of the initial disease, and then has also been mentioned kind of the down the road effects and really the long-term effects that we'll be looking at in the future as well. And I would say just the impacts on our family and as support has been, I think just trying to listen and understand as best of my ability what Amanda needs at the time of, when she's going through an episode, and then just trying to fulfill those needs and keep up with the kids and see what they need at the same time, because their needs don't stop either.
Excellent. And Amanda, On a very personal note, because you're sitting next to your husband, who is a great support system for you, what are the one or two things that you would say that he has done that have helped you in ways that we don't traditionally, we wouldn't really identify? So he took you to the doctor's office, we identified that, but how can family members really support you?
Yeah, I would say I'm very lucky in the village that I have. The best way family members can support is educating themselves about what is this disease and how does this truly impact my loved one. To Dr. Masias' point, yes, your episode is over, you walk out of the hospital, you're done with your treatment. However, it's so rare. How do we find the right people? So education, I think, is key. It's really important. And then also I can just say to any of my village who is on this call, I could not do it without them. It's my husband supporting me, bringing me, the only soup I want to eat for 3 weeks because it's the only thing I can keep down every day in the hospital. Or, it's my family from Chicago coming and helping us with our children because I physically can't take care of them. I'm luckily have in-laws nearby, and the village is really what helps me as a patient be successful because I couldn't do it without any of them.
Excellent. Vicki, I know that you all through the foundation do support families, and number one, I think with most diseases, it's just I need an ear, I need education. But as we get back to awareness, because this is a rare disease, how does the lack of awareness impact the aTTP patient or the physician or the community?
So as far as lack of awareness, first, early recognition, diagnose, and treatment is key for survival. So that means an ER doctor needs to at least suspect that that person in the ER might have TTP. So if they at least suspect it, then they can get in touch with the hematologist who can confirm, he or she can confirm the condition so that treatment can begin immediately. So, because what else can happen is a person can be mixed diagnosed. I know Amanda spoke about being diagnosed with aTTP. We hear that story time and time again in our support groups, or if it's not aTTP, it might be something else. So not all hospitals are equipped to recognize TTP. And not only are they not equipped to recognize it as the ER physician, but then is the hospital equipped with the plasmapheresis? Do they have to wait for the Red Cross to bring the blood, So there's definitely a protocol or some type of documentation that could be available in ERs that would be very helpful to assist doctors with identifying TTP so that this life-threatening disorder can be treated as a medical emergency and that patients can get treatment in a timely manner.
Excellent. We have some questions from Facebook, but I would ask our moderator to put the following from me, Dr. Sharon, let's keep it real, in the chat. And this is something that I used to teach all around the country. Number one, no matter what the disease, no matter what you're going to see your doctor for, whether it's urgent care, ER, your primary care, your toe doctor, whoever, you should never, ever engage with a physician or healthcare provider and not walk away with, number one, what's my main problem? Why is it important to me? And what do I do about it? We're talking a lot about education. This is, and I'm sure Dr. Masias will 100% agree, physicians cannot do it alone. Healthcare professionals cannot do it alone. And we need to hear from you so that, as Vicki says, this is a rare disease. You present, this could be a stroke, anything. So what's my main problem? Why is it important to me? And what the heck do I need to do? That's called Ask Me 3. And now just to that, we have some great questions. This is a question from Gillian, just wondering if anyone else has had a headache, and this would be to you, Amanda, since being diagnosed. She was diagnosed in 2014, and it's the head pain. And Dr. Masias, you can answer after Amanda, that she struggles with.
Sure. So yes, I certainly do struggle with headaches. It's an on and off thing that I've actually always struggled with. I've had chronic headaches, but I do find that prior to any relapse that I've had, the headache is unbearable, and it's something that I battle with, but I'm controlling through medication and working with my doctor.
And Dr. Masias, I know you're going to answer that for us, but I'm going to piggyback. Another question from Michelle: can the doctor also explain why it's so important to monitor Adams TS13 even if blood platelets are high? So that's a 2 for Dr. Masias.
Yes, sure. So certainly headaches are unfortunately quite common in our TTP population. There's been studies that have shown that the prevalence of headaches after diagnosis of TTP are higher compared to the general population. We're not really sure why this happened. I think it relates to question number 2, which I'll try to explain a little bit. But certainly, you know, you should see your primary care doctor and establish sort of a treatment strategy for when you have headaches. And I do want to go what Sharon, you said before about being informed about your disease. I just want to add, please don't Google maybe aTTP, because you'll see the most horrible things. And not that it is not a horrible disease, but it's better to go to really sources that will enrich you and that will provide you useful information on where to seek help and whatnot, like Answering TTP and the USTMA consortium. Now, regarding the Adams TS13, so remember, that's the main problem with TTP. When we don't have Adams TS13, we don't have our Caesar to cut the von Willebrand factors, and then clots will happen and low platelets will happen. So once a patient is diagnosed with TTP, we do follow this Adams TS13 level at the beginning, every week after discharge, and then every month, and then every 3 to 6 months indefinitely, depending on if the patient has had 1 relapse, maybe no relapses, then they can come every year. But if they have recurrent relapses, we certainly do a closer follow-up. And the reason for that is because we're trying to catch a relapse earlier.
Excellent.
If you go to your doctor, you feel fine, there's really nothing going on. Like one of the questions says, hey, my platelets are fine. Why do I need to check the Adams TS13? But say that everything's fine, but we do see that your Adams TS13 is very low. Your doctor will talk to you about certain things that we can do or we aim to do to prevent relapses. Meaning there are therapies that are aimed at preventing relapses that can be considered when patients feel fine, their laboratory tests are fine, but they do have a deficient Adams TS13 activity.
Excellent. And you answered 2 or 3 other questions from both Sherry and from another person on if the Adams TS13 are over 100%, like at 150 is a bad thing, etc. We do want to make sure, and we are going to give resources and places for you to go for information. I love, and I have the mug, your Google does not equal my MD. Now, but there are wonderful sites like NIH, CDC.gov, and all of that. And now we're hearing a lot about misinformation on the internet. So go to, please go to reliable sources. And this is, and speaking about misinformation, we would be remiss in 2021 if we did not bring up the big word, COVID, and how it interfaces with this disease. And briefly, because we're running out of time, but briefly, how Amanda, and we have another question for you, Vicki, on how you all educate the community, but from our perspective, how has COVID-19 really impacted TTP, or has it not? Jump in.
Sure. I mean, I can speak from my personal experience. I luckily have the capacity to work from home, which has made a difference in my life because as an ATT patient, you're not actively immunocompromised unless you're receiving treatment or you're on medications for it. So, is there any increased risk? I'm not really sure from the medical perspective, but I know that when I had my relapse this summer, it was a very different experience in the hospital because it was during the middle of COVID. I couldn't see my children. I couldn't have any visitors. And to talk about isolation, you're in a room, by yourself, receiving life-saving treatment, possibly using a commode in front of nurses, and then you don't even get to have that interface with your family. So I've almost been shelter in place now for like 2 years, and I'm lucky. I am very lucky that I have that opportunity. But yeah, it's definitely been an impact. It scares me more. I'm a little more nervous. My children stayed home from school last year. We did homeschooling. That was one impact because I was nervous about what could come home with them.
Before Dr. Masias, Vicki, I want you to answer this from the perspective of your foundation and your outreach and how that has been impacted by COVID-19.
Okay, so for the outreach part, support groups. The support groups were actually being, we didn't stop support groups. We were actually prepared for that. We were already doing some form of hybrid support groups prior to the pandemic. So, but now we're 100% virtual. We actually do support groups every other month. So that because of COVID, we're now in a national support group. So we're reaching domestic and internationally as far as UK, Canada, Australia, and domestically all states here in the US. So that's been the blessing about being able to reach more people. But on the downside of that, TTP patients, the isolation, they want to be able to meet in person. They want to be able to see that other person face to face that is experiencing the same thing that they're experiencing. Yes, we're doing it on Zoom and we see faces, but sometimes they need a hug or something, and we're not able to do that right now. So, and education, sorry. So the other thing is we do education annually. We do a DTP education event in collaboration with University of Penn. And that also went national this year. So our reaching has expanded and we're able to help more people. And when we talk about awareness and educating, we're educating the patients and their loved ones, but there's people in the community that is also have a desire to learn more about TTP as well, because they hear your story and they say, well, if that can happen to you, I know in 2012, the numbers were 1 to 4 in a million. Now they say 2 to 5 or 6 in a million, but never in a million years would I have thought that something like that would impact my life. So people are eager to learn. And that's what our goal is to share that awareness.
And Dr. Masias, briefly, what have you seen in this COVID world?
Crazy world, yeah. We recently had a patient-centered meeting in TTP and I gave a talk on that. And I said last year, when we were planning this meeting, I was hoping that I didn't have to talk about TTP this year. And unfortunately, I am gonna have to keep talking about COVID for a while. So to have a TTP episode, you need the low Adams TS13, but you need what we call the second trigger. You need something else. And that something else is usually a viral illness. It could also be a pregnancy, it could be a surgery, but COVID, having a COVID infection certainly puts you at a higher risk of having a TTP relapse. If you already have a diagnosis of TTP, and if you didn't have it, it could be the first time that you have it. So I want to make a final and very important point. I do think that it's extremely important for our TTP community to get vaccinated against COVID-19. And I know there's a lot of scary things going on. That's why you shouldn't Google. But certainly preventing the disease in patients with the diagnosis of TTP is extremely, extremely important.
Excellent. And as we wrap down, we only have about 4 minutes left. I know there's some questions in the chat. A healthy woman We're going to get back to answering that on the Facebook page. I'm just commit y'all to that. But I would like each of our participants, and thank you all for tuning in and dealing with us in our little glitches. But if you could give me just a sentence or two, and actually we got 4 minutes, so a sentence on, at the end of the day, for the persons that have tuned in and that will tune in, from your perspective, what do you want them to know? And we're going to start with Dr. Masias, then go to Vicki, and then go to Amanda. What would you like to leave them with, and what should they know from your perspective about aTTP?
Sure. I would like to leave them with the understanding that the most important thing as a TTP patient is to keep all your health maintenance up to date. Stay healthy, meaning having a healthy diet to prevent diabetes. If you have these long-term problems, maybe high blood pressure, have a primary care physician, work with him or her, come up with a plan, and stay healthy to prevent relapses.
Excellent. Vicki?
Speaking to the TTP patients and their loved ones, I always recommend that they keep a journal, because you are your own best advocate. So you can go to the doctor and you can share your history of what's going on with you, with them. And sometimes you might be out of state and you're going to a foreign hospital that's not associated with you, that don't know your history. But if you are journaling and you're keeping track of how your body is performing and what's going on with your body, that can help you in your treatment.
Excellent. Amanda?
Yeah, as a patient, I would just like everyone to walk away with the fact that, while TTP is a rare disease, you're not alone. There is information out there. And while it can seem extremely isolating and you may experience PTSD, anxiety, depression from having this diagnosis, there is support out there for you.
Excellent. I, on behalf of Healthy Women, want to say thank you all for joining. Thank you to the panelists. I am Dr. Sharon, so my 3 words are, what is my main problem? Why is it important to me? And what the heck am I going to do about it? It's called Ask Me 3. And that's for anything, but especially in the face of a rare disease. I want to thank you all again for participating. And once again, thank you, Sanofi Genzyme, for your support on today's event. We got to do this again. We lost a few minutes. We got to do this again. I invite you to visit healthywoman.org. And I must give an opportunity for the panelists. If there's a resource site, could you give that site or phone number or whatever for persons that are on this Facebook Live and looking at this recording, where they can get more credible, somebody type credible information on aTTP?
I already put the names there. I don't know that, I don't know the websites exactly, but that you're allowed to Google Answering TTP Foundation and USDMA Consortium, and you'll get the websites.
And Vicki, your website?
And the website is rewin.org.
All right. Amanda, any insight into information? I know you talked about Vicki's foundation.
Yeah, I think answeringttp.org is great. It's an international organization, and tomorrow's TTP Awareness Day. So if you can donate, that would be wonderful, and get out and walk in support of those that you love.
Thank you all so much. This was informative, and as we promised, it was not boring. Great information. Share it on your Facebook pages and in your social media sites. We need to learn more about this rare disease. Thank you all so much. Have a great Friday.
Yes, thank you, Sharon.
Take care.